Good morning, Virginia. This is Virginia This Morning.
This segment is sponsored by Virginia Physicians for Women.
Well, it's not a topic that many are comfortable talking about, but urinary incontinence happens more often than you realize, and it tends to affect more women than men. Award-winning Dr. Boudaji from Virginia Physicians for Women is here with us this morning. Doctor, it's great to have you.
Thank you for having me.
You're with us this morning. We're talking about something that a lot of people avoid talking about, urinary incontinence, or I guess more commonly, leaky bladder.
Correct. It's very prevalent. A lot of people have it. You can tell almost 30% of the female patient or female woman will have it one time in their life, and it will stay with them. Usually it happens with older people, but I want to insist here that this is not a normal aging process. It means it is a disease and we can fix it. You don't have to live with it. That's the message of today.
I did key in on the fact that you said they'll have it at some point in their life, but that it is something that you are able to remedy.
Correct. This is like anything, like diabetes, like hypertension. You have it, but it doesn't mean that you don't have to treat it. It is not normal to live with that. If it's bothering you, you have to fix it.
Is this something that happens relatively quickly, or is it a progressive symptoms that happen before you realize I'm leaking, I've got an issue?
Let me be clear, not everybody will have it. There is some risk factors. I mean, people are more at risk of having this problem more than the other people. And I will be more specific. If somebody has more than one child, deliver 2 or 3 children, they are by far higher risk compared to other patients who don't have kids. So this is one of the risk factors, and there is other one. Is that something that happens usually at certain age? When we get older, we are at higher risk, but doesn't mean that it can happen at certain age.
Treatments, what are the options that are available?
There is 2 different types of incontinence. There is one what we call urgency incontinence. It means we have to rush to the bathroom and sometimes we cannot hold it. And there is another one frequent, we call it stress incontinence. It means when the patient coughs, they leak, or they run, or they jog, they leak. 2 different problem. The first one, the urge incontinence, usually it's a medical treatment. We give them pills. And the other one is a more surgical or a physical treatment. It means we can start with some exercise, we call them the Kegels. And if it doesn't work, we can advance a little bit in this treatment. We end up with surgery usually. And the surgery is a small procedure, a 15-minute procedure that it can be done.
And then how quickly would you see results following a procedure like that?
If you have a procedure done, we tell all the patients based on these studies usually, 90% of the people are very satisfied in 5 years, up to 5 years. And another 80 to 90 are satisfied up to 10 years, which is pretty good.
Now this is something that you have to talk to your doctor about. It's not, is this something necessarily that during a regular exam, a doctor might be able to determine, oh, you've got an issue here? Or is this something that you have to kind of get comfortable with and share with your doctor?
You will be surprised, 50% of the patients don't share this problem with their doctor. And 50% of the doctor don't ask this problem. So this is like a taboo, or we have to be a little bit more open with our doctor. The primary care physician has a key job here, and the patient has to be responsible. And if you don't seek treatment, you won't get it.
You mentioned the surgical option, and in some of the research that I was doing here, there was an option using mesh, but we've heard a lot recently of mesh in the news, and there were some problems.
Great, thanks for asking. Big deal about the mesh, and everybody thinks that mesh is like something you don't have to get it in your life, or it's very dangerous. It's not true. In 2011, the FDA issued a warning, and they said, to make it easy, a vaginal mesh for prolapse, it's a higher risk, not like we thought before. But in 2012, they issued a clear warning, and they said, don't confuse between a sling that we use for stress incontinence and a vaginal mesh that we use for prolapse. The sling that we use for stress incontinence, it is a standard. It's good, no risk. There is always small risk, but not the one that you see on TV, on the commercial, not this.
Okay, clearing up some confusion.
Thanks.
Best to talk with your doctor. Thanks for being with us, Doctor.
It was a
Appreciate
pleasure.
it.
It was a pleasure.
Virginia Physicians for Women is located at 10710 Midlothian Turnpike, Suite 200, right here in Richmond. You can find out more by visiting online, vpfw.com, or Facebook at VAPFW. They can also be reached by phone at 897-2100. Cheryl, what's coming up?